Because of potential toxicity, bacterial resistance, and the availability of more effective alternatives, chloramphenicol is rarely used in the United States. So we'll make this sketch quick. On an exam, this drug might come up during a clinical scenario that involves the treatment of patients during a meningitis epidemic in a developing country, and will probably focus on the severe side effects of this drug, which includes anemias and gray baby syndrome. Well, with a name like chloramphenicol, we couldn't help but make this sketch take place at a chlorinated swimming pool. So let's get started. Chloramphenicol is a potent inhibitor of microbial protein synthesis. To show this, we have a woman sitting next to the pool on a typewriter. She brought her work home with her and is getting some typing done while the kids play in the pool. Typewriter look familiar? Almost ribosome-like. Chloramphenicol binds reversibly to the 50S subunit of the bacterial ribosome and inhibits peptide bond formation, thus stopping the SMOM's translation. Whenever you see the ribosome typewriter, think of a paper jam, representing bacteriostatic. Inside the pool, we're going to cover the two main uses for chloramphenicol that you need to remember: meningitis and Rocky Mountain spotted fever. Let's start with meningitis. As mentioned earlier, chloramphenicol is not widely available in the United States. However, it's still used in developing countries where it's often the cheapest treatment available for meningitis. For example, epidemics of meningitis due to Neisseria meningitidis are reported almost every year in sub-Saharan Africa, and empiric treatment often involves 1 or 2 intramuscular injections of long-acting chloramphenicol. In fact, chloramphenicol is active against the usual meningitis culprits: strep pneumo, H-flu, and Neisseria meningitidis. To highlight activity against these meningitis-causing bugs, let's sketch in a kid playing in the pool wearing a water polo cap that looks just like our recurring meningitis space helmet, with red meningitis mohawk and all. He's playing with a globe-themed ball to symbolize chlorampphenicol's use in developing countries across the world. His sister is climbing up the side of this pretty awesome landscaped pool. Wait a minute. Spots on her hands and feet? Wait, are those ticks? Wait a minute, rock climbing? This looks like Rocky Mountain spotted fever to me. Chloramphenicol may be an alternative agent to consider in serious rickettsial infections, such as Rocky Mountain spotted fever caused by Rickettsia rickettsiae. This is especially important in pregnant women when doxycycline use is contraindicated. Let's finish the sketch with some important adverse effects. Chloramphenicol commonly causes a dose-related, reversible suppression of red blood cell production. This anemia is represented by these deflated red inner tubes on the side of the pool, kind of like red blood cells that haven't quite developed, and definitely reversible. Also, chloramphenicol can cause a rare but possibly fatal aplastic anemia due to irreversible bone marrow suppression. A clear plastic bone, here shown as a floating pool raft, is our recurring sketchy symbol for aplastic anemia. And finally, gray baby syndrome. Newborns lack an effective glucuronic acid conjugation system, meaning they can't detoxify and degrade chloramphenicol, so the drug accumulates, resulting in gray baby syndrome. We'll sketch in a baby having a tough time learning to swim, and looking pretty gray if you ask me. Notice also that his flotation device kind of looks like a liver that can't quite detoxify chloramphenicol. The syndrome involves flaccidity, hypothermia, gray color, and shock, and this baby does look pretty gray and flaccid to me. To avoid this effect, chloramphenicol is used with caution and with limited doses in infants. And that's all you need to know, so let's sum up this sketch. Chloramphenicol works by reversibly binding to the 50S subunit of the bacterial ribosome. Because of potential toxicity, chloramphenicol is rarely used in the United States. However, it's still used in developing countries, especially useful during meningitis epidemics. And also remember that it has activity against rickettsial species, like Rickettsia rickettsiae, the one that causes Rocky Mountain spotted fever. Major side effects include a reversible anemia, an irreversible bone marrow suppression, and gray baby syndrome. So remember, later in life, when the hospital seems a little too confining and you want to see the world and do some volunteer work abroad, keep chloramphenicol in mind during that meningitis epidemic.